Hello everybody, this is Dr. Robert Daniels again. And I'm going to give you my third lecture on the series I call The Dark Side of Coffee. And in this lecture, I'm going to tell you about the successful treatment that rid me disabling symptoms that were making my life unbearable. And remember, I was fecally incontinent, I was urinary incontinent, I couldn't sleep on my own skin, I had metabolic syndrome and obstructive pansinusitis, to name a few. And this treatment cured all of those diseases. And prior to that treatment, I had gone to dozens and dozens of doctors, hundreds and hundreds of times, with no success. And even after I was diagnosed, it took 7 years before I got a really successful treatment. And I even traveled overseas to the Philippines to start the treatment. So it shows you how difficult it was for me to get the treatment. I'm also going to tell you in this lecture how the treatment works and which patients it is appropriate for. Before I tell you about the treatment that was successful with me, I just want to review a few things from my previous videos. Here's what I believe, that if you're a coffee addict like me, if you consume large amounts of coffee over a long period of time, that coffee causes chronic gastrointestinal inflammation. And gastrointestinal inflammation leads to leaky gut syndrome. And that leads to gastrointestinal mucosal permeability. And that permeability allows your immune system to be exposed to proteins that it wouldn't otherwise be exposed to. And then your immune system becomes sensitized to those proteins. And your immune system treats those proteins, which it normally wouldn't be exposed to, as pathogen invaders. And then your immune system activates the inflammatory process. And so you end up with a system that's chronically inflamed and an immune system that is hypersensitive. And rituximab is the treatment that I was telling you about, is such a wonderful treatment. And the reason that rituximab works is that it blocks a major pathway in that inflammatory process. And it does that by blocking B cells, B lymphocytes. And it does that by attaching to a surface protein on the B lymphocyte called the CD20 surface protein. And by blocking B cells, it keeps the B cells from producing antibodies to all of those proteins it's sensitized to. And it keeps the B cell from activating the immune cascade, which causes so much inflammation, not only locally in your gastrointestinal tract, but corporally in your whole body. So in essence, rituximab acts as a sedative to calm down your hyperactive immune system. And if you stay on rituximab long enough, you will stop producing sensitized B cells and start producing normal B cells. And I've been on rituximab for 3 years. I have none of the debilitating symptoms that I had before of fecal incontinence, urinary incontinence, severe fatigue and muscle weakness, obstructive pansinusitis, and many others. And remember, again, I had gone to doctors for 20 years, dozens and dozens of doctors, hundreds of appointments, and never one time did they mention autoimmune disease, and nor would they have known to put me on rituximab. And that brings me to the doctor that you would need to see if you're a patient like me who has severe symptoms that doctors have been unsuccessful treating. And that doctor is a rheumatologist. Now, one of the problems, and probably your biggest problem is getting referred to a rheumatologist, because I never bumped into a general practitioner, a gastroenterologist, or a urologist that knew to refer me to a rheumatologist or were successful in diagnosing and treating me. So I took 1.5 years off from work and used the internet to study all of my symptoms and do searches on all of my symptoms, and saw how they related to certain autoimmune diseases. And you need to educate yourself about your own condition, because, as I said, I never bumped into a general practitioner, a gastroenterologist, or a urologist that knew an autoimmune disease to recognize that I had an autoimmune disease. The other thing that's important is your family history. And things that you think are not important, you think are just innocuous, can be important in your history and your family history. So try to remember everything about all of your symptoms, because the most subtle thing can be a very important thing in diagnosing your disease. So in closing, I want to say that for everybody that does have really serious debilitating symptoms, you're going to have to be your own advocate and proactive about your case, because if you aren't, you may never get referred to the right doctor, and you may never get the right treatment. As I said, I went counting the time from when I started treatment, but it wasn't the most effective treatment, to the time that I actually got effective treatment, it was something like 30 years. For the conditions that I have, it takes an average of 9.5 years before people get diagnosed from the time they start having symptoms. And for those people that don't have serious symptoms, that have only minor symptoms, but are coffee addicts, if you drink large quantities of coffee long enough, believe me, your symptoms will get more serious. So if you only have minor symptoms of esophagitis or reflux, or some minor fatigue, or some minor gastrointestinal symptoms, you should consider seriously discontinuing drinking coffee. So hopefully I've helped you understand how coffee can be a source of inflammation and disease, and so that you could be more aware of something that maybe you didn't think was causing your symptoms, but might be. Another sort of important point is there have been many studies done that show that community coffee pots and coffee pots in general are highly infected with bacteria and fungi. You know, some of the bacteria are potential pathogens like E. coli or Klebsiella pneumoniae. It's hard to say if that contamination is a source of disease. I personally think that the inflammatory aspect of coffee is probably more a source of disease than that contamination of the coffee pots. But it is possible that that contamination can also cause disease. So coffee is wonderful. I love smelling the smell of roasted coffee. If I could drink coffee, I would. I love coffee, but coffee consumed in large quantities over a long period of time, I can guarantee is going to produce symptomology and inflammation. So thank you for watching. Please subscribe, like, and share. Goodbye.